There it is. We're live with Dr. Marci Catalo Madruga.
Hey,
Say that, or CM, Dr. Marci CM. It's like Louis C.K. Is that what you're going for?
my real name is just so complicated that I
Yeah.
felt like it was a barrier to entry, and so I figured I'd simplify it a bit.
Well, I was just listening to a podcast with Louis C.K. and that's why he made it C.K. It was like a Hungarian name, I think, and it sounded kind of like that, but it was like very difficult to pronounce. So he just CK makes it easier. So CM, there you go.
Yeah.
So Dr. Marci, we'll make it simple, is also a physical therapist like myself, doctor of physical therapy, and very interesting. Something I've been in the space for, and you've been here in Colorado how long?
I moved here in 2002, so I've been here a while.
Yeah. You have been here long enough that your time here can drink 21 years. There you go. That's the quick math on that. But yes, I have just moved here to be 2 years for me, and I am blown away by the rights that we have here as physical therapists that we do not have in most other states, including being able to order blood work, order imaging, all that kind of stuff. So there's a lot more autonomy, and it's stuff that the physical therapy profession talks about, but is not very prevalent state to state. So having practiced in California and New York before this, 2 states where I couldn't even put needles in people, I think that's criminal, but that's a whole nother story. But that takes us to the functional medicine space that you practice in. Something, again, I've been fascinated in. You have a bunch of letters behind your name. Is the CFDN, is that the functional diagnostic nutrition?
That is the functional diagnostic nutrition. And then I also have another one that is actually functional dry needling as well. And so there's that one, and those two get like kind of confused a bit, but and then I also recently got certified in food as medicine. So there are letters that I should or could put after my name, but again, for simplicity's sake, I'm not putting them there because it becomes too much. It becomes the entire business card, right?
Yeah. I stopped at some point. I was just like CSCS, CrossFit stuff, kettlebell, Olympic weightlifting, again, dry needling, all these other things, rock tape, again, yeah, it's a lot of letters, alphabet soup. So, again, yeah, that's a whole nother conversation, maybe for another time, of like, what are people looking for? I don't think a lot of people are looking for functional dry needling necessarily, but they want to know that you can do dry needling. I assume, again, here in Colorado. So super interesting stuff. The functional diagnostic nutrition, which I did go through their coursework. And again, it's not something I'm putting out there because I've not been practicing in that space in terms of, do they still work with BioHealth in San Diego? Was that the lab?
Yes. Yep.
Yeah. So yeah, I went through their whole thing. What's the bald guy? Reed Davis, is that his name? Yep. He's a very interesting
webinar with Reed yesterday.
Yeah, he's an interesting guy. And yeah, so that's something I went through a long time ago. And again, I couldn't really practice it the way I wanted to until I got here to Colorado. So now it's something I'm getting my legs under me, and it's something one of the reasons I wanted to have you on here, talk about, for selfishly, how I can start helping people through these other pathways outside of traditional orthopedic physical therapy, which is something you did for a while. And then, functional diagnostic nutrition. Also, interestingly, if I recall, I took that course a long time ago. I want to say 2011 or something like that. And they're very clear to say, we don't diagnose anything. Then why do you have it in your name? And they don't deal with nutrition either. They're not, they kind of allude to it, but yeah, they're like, it's a weird name for something that they do not do. And functional is just a kind of catchy term at this point. But
I think it is the current catch phrase, right? Because there's like functional movement systems, and there's functional dry needling, and there's functional pelvic floor, and there's functional health. And so I think it is kind of the catch phrase at the moment. And I don't think that was the intention. Like, if you listen to like Dr. Mark Hyman speak at all about functional medicine and the way that he believes it is really truly getting back to the basic function of health, I don't think he intended it to ever be that catchphrase. I think he really intended it to be No, we want to go back to the basics, the bare minimum function that your body should be doing that it's not doing. And that's
Right.
why you are doing what you're doing right now. And that's why you're in my office.
Right.
But yeah, I think a lot of people are getting caught up on, well, do you do functional this or functional that instead
Yeah.
of how can you help, which is the ultimate goal, right? And I think probably similar to you in orthopedics. I graduated PT school in 2005. I think you graduated somewhere around the same time, correct?
2008.
Right.
I
So
started in 5.
we're not that far apart in terms of like what we learned or where we learned it. But I think the part that is missing in the physical therapy education really is the conversations around, what causes someone to end up with chronic regional pain syndrome after a knee replacement? Or, how come some people recover from whiplash in 3 weeks and some people take 7 years? And the basics of that comes down to a lot of inflammatory processes happening in the body and potentially nutrition. I mean, a lot of times when we look at chronic pain patients, the nutrition that they're using is not a good strategy. And then also their mindset. And I think when we start talking about all of those things, yes, there's the whole movement of healthy at every size, but can you truly be healthy at every size when your body wasn't meant to carry dead weight? And also, we know that obesity drives some inflammatory markers. It also lowers HDL, which when HDL is lowered, increases your risk of a heart attack, which increases inflammatory processes. We know that when you're carrying extra weight, it also produces more estrogen and causes your testosterone to become aromatized into estrogen. And so when we're talking about healing and we're reducing the amount of testosterone that's produced just by body weight alone, are we doing a disservice to our orthopedic clients by not addressing those things?
I believe the answer is yes. I'm 100% with you. Even the APTA very specifically talks about, and that's for anyone listening, the American Physical Therapy Association, the kind of governing body that helps direct our profession here in America, at least. And they have it very clear on their website that, yeah, we should be talking about nutrition. And it was interesting to me. I did at the beginning of COVID lockdown, I joined a study group of journals that, sometimes, I don't know if you've ever done that with other physical therapists. And this was a young-ish group from Portland. Mostly, I was the only one not from the area. They were nice enough to invite me in. But yeah, one of our first articles was about nutrition and how that plays a role. And a lot of them were in more traditional spaces and said, like, I don't have time to address this. And again, I'm like, well, can't we improve, outcomes by 25%, let's say, by just getting people to eat less and get rid of inflammatory foods, to your point of inflammation, things like that, and eat better. However, we have that conversation. Of course, it is a big conversation.
Right.
A lot of them weren't even referring out to a registered dietitian, which I've done some podcasts about. The term nutritionist, registered dietitian, even functional medicine, a lot of these terms are not very well regulated. Registered dietitian is the only one that has any real, I guess, diet criteria to be there. My dog is in the back having a good time. Sorry about that. So, and yeah, nutritionist is a term that my dog can be a nutritionist. You can just say, hey, I'm a nutritionist. Clinical nutritionist is a little different, but for the consumer, not knowing the difference, you get these nutrition gurus on Instagram or whatever. But then you come over to a term like functional medicine, again, which is not regulated. Right. You have certifications, and there are programs that we would hope people are going through, like Dr. Marci, and you did it through Nordic. Can you tell us a little bit about Nordic? I had not heard of that company before.
Yeah, so Nordic VMS, they are actually out of the Netherlands, and there's a group specifically that trains physiotherapists, is what they call us in the Netherlands.
Everywhere but the US, we're physios.
Yeah. So they do the training there, and they really focus it on extending, because in PT school we do get some physiology, right? There's that knowledge of physiology and what happens, Krebs cycle, all of those kinds of things. But they go more in depth on the detail on that. And then They also get into more of the autoimmune disorders, which, of course, as physical therapists, we see people with Crohn's disease, fibromyalgia, with rheumatoid arthritis, lupus, Sjogren's, those kinds of things. And we are trying to help those people, but it extends on that knowledge of what's happening just on the physical side of what you're seeing, and possibly even what you might be seeing in terms of the person's symptoms day to day. And it pushes it into what's happening at the cellular level, and then how can you help the client reverse that. And then they also, you can do some testing similar to FDN. You can do some testing, get ordered through Nordic. And then they also offer a certification in genetics after you've gone through the functional medicine practitioner training. And so I've gone ahead and done that as well, because there are things like, for your patients that are, I only want to see a same-sex PT who understands depression and anxiety, right? Because they may have been in a situation where that's popped up before, or they feel uncomfortable working with someone of the opposite sex or someone of the same sex because of an experience in their life. The genetics are something that can help you figure that out too. So I did a post about this yesterday. COMT genes, if you have somebody with a COMT mutation, they're more likely to have anxiety. They're also more likely to have inflammation because they don't have appropriate methyl donors. And so those are all things that we can look at in terms of helping the client. And I think Nordic does a very good job of like taking what we have as PTs and extending that knowledge, as opposed to treating it as if you had gone through medical school and you already know the basics. They really just try and meet you where you are and push you further in your knowledge. And then the thing that I like probably most about Nordic's program is they, like this week alone, had 3 free webinars that you can do for continuing education, that actually help you continue along your progress, or also kind of remind you, oh yeah, I should be looking at that when I'm dealing with a patient who presents like X, Y, or Z.
Mm-hmm. Mm-hmm. Yeah, and in your intake form here, you want to talk about gut health and sex dysfunction. So I'd love to hear how you work with that as, again, a physical therapist who is certified as functional medicine. Again, stuff that I talk about a lot with a lot of my clients, traditionally more outside of the physical therapy space, and kind of have to separate those two. But I'd love to hear how you combine those worlds.
Yeah, so a lot of my clients come in, especially if you've had a client with back surgery, hip surgery, and one of the questions is, when can I have sex again? And the standard answer is from the ortho is, we're leaving that up to the PT, but not before this date, right? And then we have to make that decision. But how do you know if somebody's actually healthy enough to do that, and engage intimately with somebody else? And one of the areas that we get into, especially because a lot of times if they're coming to you after surgery or they've been in pain for a while, they're on pain meds. And we know that pain meds start messing with the gut in a variety of ways. But one of the things it does is creates constipation. When we have creation of constipation, there's a lack of detoxification. So what starts happening there is these toxins build up in the system, and they actually start breaking down the little lining of the blood vessels. And your smallest blood vessels that you have are in all of your erectile tissues. So they occur in penile tissue, clitoral tissue, but then also even something as simple as regulating your body temperature. All the little hairs on your arm have blood vessels that supply blood to the erectile muscles of those hairs. And so it becomes even hard to regulate body temperature appropriately for these people, and they don't understand why. And they go in and think, maybe there's something wrong where I have peripheral neuropathy. Well, it's not that they have peripheral neuropathy. They have something that started in the gut because of a pain medication. And so how do we get the gut working again the way that it's supposed to? How do we do a detox program for them? And then we repair these things. And an added side benefit is that for guys, morning erection comes back. For women, they're able to achieve orgasm during sex.
There you go. And one of the idioms, I guess, in health is you should be waking up hungry, horny, and happy.
Yes.
So if any of those things are not happening, and I know that's a big one in the functional medicine space, especially in my experience in that space. So yeah, if that's not happening and you're out there listening and you want to change that, got to reach out to someone like Dr. Marci. next concept. Well, and I want to point out the fact that, again, even in the clinic space, physical therapy space, someone's coming to you for recovering from a hip surgery, talking about poop even is
Yeah,
taboo. And it's like, what do you, what? I didn't come here for this. And unless you really, take the time to explain it and connect the dots, a lot of people are not even open to that conversation in my experience. So there's definitely an art to bringing up those concepts. And unfortunately, again, people don't want to talk about that. I still always, when I work with folks on nutrition, I'm still like, hey, every time you have Indian food, like, you're on the toilet for 2 days. Like, it's not a, you have a direct effect. Like, we see the correlation so
right.
clearly. We can't say it's causation, but that's a crazy thing. And our brains are not wired to connect those dots somehow. And then next time you're like, I'm craving Indian food, and it's like, not worried about the effects of that. So it's kind of incredible that again, we can ignore a lot of these things. And again, this is what will keep us in business, I guess, forever. But I know we're if it was our ideal, we'd be putting ourselves out of business by helping people avoid a lot of these issues. But at the same time, I think we're happy to help people who are struggling with these things and connecting those dots. And again, I assume you also, similar to me, get a lot of folks who have already gone to 10 other clinicians and have not had the outcomes that they're looking for. Can you talk a little bit about that kind of, how often you get that and how much we would love to catch people, I think, earlier and upstream.
Well, I think, as you know too, in the orthopedic physical therapy space, there's been a huge jump of hospital-owned clinics, physician-owned clinics, particularly surgeon-owned clinics. And the idea there is on productivity, right? So their PTs are scheduled somewhere between 4 and 6 clients an hour, and the PT doesn't always see the patient. And so something might be happening with the patient, and the person that they end up seeing isn't trained to recognize what's happening, because even in physical therapy, we get trained in differential diagnosis, right? So you might not catch it the first visit, the initial eval, if you have 6 patients in your office, because you're focused on someone's walking up to you asking you a question about how you should move the next person forward, or that kind of thing. But if you have that time to dedicate to someone that's sitting in front of you for the very first time, there are all kinds of things that you might catch that then you could help them more, even in a traditional space. Um, and some of the simple things, right? Like, we have patients who come in, and I don't know if you treat vestibular dysfunction, but that's one of my certifications. I treat vestibular dysfunction. Primary cause of vestibular dysfunction that I see is actually blood pressure medication.
Mm.
And blood pressure is not a diuretic deficiency, right? It's a lifestyle issue. And so we can't out medicate the lifestyle issue, and the medication could be lending to this other problem. And so we want to kind of keep all of those things in focus. But if you're not taking a complete history, you're never going to know that. You're never going to see it, because somebody else put that thing in their chart that said this is their meds list, and you never even looked at it. So I think, and across the board, right? It's not just physical therapy, but across the board, one of the things that's happened in medicine is the visits have become less than 6 minutes. And so how do you take a thorough history in less than 6 minutes? How do you actually look at the body language of your patient when they're speaking to you to even know what's important and what's not important to them about what's happening? Like, it's one of those things that we kind of, I think, we've stopped putting a personal front on medicine and started making it like where everyone's talking to you through a screen with the computers, right? I mean, yes, we're talking on a screen now, but in medicine, that becomes a barrier to someone communicating, because if you're not going to even look at them to hear them, how are they supposed to know that you care at all what's happening with them?
Yeah. Yeah, and I've been reflecting on that for my entire career, I feel like, at least. And as yeah, it definitely seems like it's just getting worse and worse. And the trap there is, like, it does sort of work for some things, and we can manage symptoms, and we can kick the can down the road for a long time. And that's, I think, the trap a lot of people get caught in is, hey, I have this back pain, like I need it to go away. I went to my chiropractor, he cracks my back, I feel good, I walk out of there. I might need to do that every few months. And this was kind of your second point. We don't need increased meds and whatever we want to refer to as medications, including chiropractic adjustments or needles or whatever the thing is that's going to address the symptoms. But who's actually taking the time to address the underlying cause? And so tell us a little about how, again, other than, is it just a lot of testing that you're doing? I'm somewhat
Um,
familiar with the systems that you've thrown out, especially including FDN going through that. But yeah, I'd love to hear how you address the cause.
so I actually do less testing than most people.
And that's what
And
I'll jump in to say, that's one of the big knocks on functional medicine
yeah,
is it's like, oh, if I sign up for that, am I doing like $5,000 in testing? And I think the
right.
better clinicians are able to whittle that down and say, well, I think these 3 or 5 tests might be the most important. So we really have a much clearer picture.
Yeah, and I whittle it down even farther. Most of my clients end up with 1, maybe 2 tests over the course of a year, because pretty much everything else you can get your primary care physician to order.
Hmm.
Most of the blood work that we need, primary care physician can order it. Most of the, like, even something as simple as like the organic acids test, Medicare even covers the organic acids test if their primary care physician orders it. So yes, that gives us a ton of information about what their body's doing and how it's processing and what you're actually absorbing. But I don't need you to spend $400 on that test when your insurance will cover it. Um, and the other thing is, I have developed these 3 questionnaires, and they are quite lengthy. It takes 2 hours to do my intake paperwork. It also saves people $5,000 in testing. Because again, I don't, based on how they answer those things, I can address like and see too, because some of it is based on a timeline. Like, okay, when did the symptoms start before age 20, between age 20 and age 40, or did it start, above age 40? So I can break that down and say, like, okay, well, obviously that's happening because this happened when you were 14. Like, so we need to go back and look at this and what was happening at age 14 to try and fix this problem. Um, and so I think those are the things that people forget, is that if you listen to the patient, if you ask all the right questions, if you are a good person with your intake, your patient will tell you exactly what's wrong with them, exactly when it happened, and they'll tell you exactly what they need to do to fix it.
Yeah, simple as that. And I appreciate that perspective. And yeah, that's something that, again, it takes most people, like we were talking about, they might have to go see 10 other people and spend 10,000 other dollars to finally be like ready to commit. And yeah, you look at a 2-hour thing, history. And I tell people this all the time at any stage of their injuries or health is you should be tracking and have like a history so that if anything ever does happen, it's worth your time to be able to say, hey, when I was 25 years old, I had an ACL reconstruction. I had a seizure when I was 13 because I had a fever of 104 or whatever. And whatever those things are, those happen to be 2 things that were personal to me. But yeah, all that said, I want to make sure we touch on your last point that January is the worst time to set new goals. Tell us why you thought that was vital to bring up today.
So this is the time of year when a lot of people set like a New Year's resolution, right? Because it's the new year and they think I need to do it now. But the truth is, you are literally in the dead of winter. And when they say dead of winter, because it's the season where things are dead and hibernating, right? They are not changing, they are not growing, they are not making progress. This is their time to rest and recover. And your body has seasons just like the year has seasons. So if you lived like in Australia, sure, this would be a great time for you to do that. But because if you're in the United States or you're on, northern hemisphere, let's just say, it's the wrong time of year for you to be setting high desire goals and putting huge expectations on yourself, because this is literally the time when your body is trying to hibernate, rest, recover. So what I tell people, if you're dead set on a January goal, you need to hire a coach because you
Mhm.
won't make it otherwise. And the research proves that out. 86% of people set the same New Year's resolution goal over and over and over again, and they never achieve it because they're setting that goal at the wrong time. So I think if you move that goal more towards the spring equinox, which is March, it's not that far down the road, right? You're setting that goal. You're saying in March, I am going to start working on this. I'm going to start walking every day. I'm going to start going to the gym twice a week. I'm going to start my nutrition plan. And then I'm going to be able to carry that through my entire year. You will be more successful than if you do it in January.
Mm-hmm, mm-hmm. Yeah. And again, when I work with nutrition clients at this point, I only allow people to sign up for 1 full year commitment, and doesn't matter what time of year we start. I don't even try to catch everyone as they're doing their New Year's resolutions. But yeah, even though it's kind of low hanging fruit, but I think those are not the clients we necessarily want. And those are probably not the clients that are looking for these higher level solutions, as if we can call them that. I want to finish off by asking about just functional medicine in general as a concept, since you're obviously in it so deeply. That again, I want to get more involved in it. I want to be able to especially take advantage of what we can do here in Colorado. I might talk to you and follow up about Nordic and some of these other certifications that are out there. We don't have to, say which ones are bad or good right here on air. But it's something I definitely am interested in. But I also am curious. Again, I've worked with functional medicine folks when I was in Southern California before moving here to Colorado for 2 years. I tried to connect with a bunch of functional medicine doctors. I was very surprised. It was mostly, and again, no, not throwing the entire profession under the bus, but chiropractors who were selling mitochondrial supplements. And it just definitely rubbed me the wrong way. I did not refer anyone to those folks because, it just rubbed me, and very salesy, very, very, talking kind of the right languages and catchphrases, keywords. But that my question becomes, again, this seems like the right solution to address this failing healthcare system that we have. And I guess my question to you is there hope that this is going to evolve? But also in terms of functional medicine, seeing how that space is not very well regulated, but also kind of emerging in its own ways, finding some good paths, bad paths. I think I've seen some bad stuff. I'd love to hear just finishing off on a message of maybe hope, hopefully hope, or complete doom and gloom. Let's see where this goes.
Well, I think with anything, right, there is good and bad, right? You're going to have people who really take it seriously and really want to see people improve. I mean, I have a couple of programs that are kind of like they're a framework, but I can make things about them customizable to each program and each person. And my goal with those programs, like my main goal, the big giant program that I run that's a year long, is to help people realize that nutritious food can taste amazing. And you don't need grains and you don't need packaged foods, right? So and in that program, we also detox. And I think that's the part that people are missing is like, it doesn't matter how much support you give the mitochondria. If you're not detoxing, you're throwing supplements at the same problem that's not fixed at the root level. And I think a lot of people try and make it almost like a gimmick when they're first starting out because they don't really know where to go. And my first experience with functional medicine was for myself. It was to relieve some SI joint pain and some other things that were happening that I was not at all happy with. And that I was told was just part of aging and being a new mom. And I was just like, that's not the answer that I want. And I'm not going on your pain meds, muscle relaxers, and antidepressants because that doesn't feel right to me. And so I think really teaching people the basics of health again, like, yes, people know what they are, but there's so much misinformation out there. I had a guy even comment, just stop eating things that your body converts to sugar. I was like, your body will convert protein to sugar. That's what gluconeogenesis does. People just don't know, right? And so until there is the right people giving the right message and speaking louder, I think that you will always have those people in the space, regardless of whether that's functional medicine, chiropractic, physical therapy, internists, family practice, lawyers. You're going to have the person who's out there spreading the wrong message about we can fix all your problems by just fixing X. But really, it's the whole picture, and it includes how your mindset is and how you're functioning on all areas of wellness. So, emotionally, mentally, physically, spiritually, in your relationships, in your career, in your communication, in the way that you are able to take in and receive information. When we start working on all of those components and we make it as simple as possible, because the goal also is not to keep someone on supplements for the rest of their life. That doesn't work. Then you're just replacing a medication with a supplement.
Mm-hmm.
So we need to not only demedicate, but de-supplement and get back to basics.
So I'm hearing hope. There's some hope in there. There's some hope in that answer. With that, I got a crying baby I need to get to, and a dog that wants to play. But I appreciate your time. I know you got to get to your twins as well. Tell folks where they could find you, reach out to you, go take your. I think I did see your 2-hour intake form. Anyone can just go do that, and
Yeah.
if they take the time, that probably means they're ready to go.
Yep. So easiest way is drmarcicm.com.
Nice.
So it's pretty
Simple.
simple.
There you go.
And that's the best way to get a hold of me.
Cool. And I'll try to put that in the show notes wherever folks are watching, listening to this as well. She's big on TikTok. That's where we messaged as well and connected there. Thank you. Appreciate it. We're gonna sign off here, and I think we need to touch base more, especially since we're so close to each other in person. We'll have to definitely touch base there. So hope folks got 1% better today. Enjoy your day. Thank you, Dr. Marci.